Thank you for joining us on News Channel 11 at 5:30. I'm Sarah Diamond. Josh Smith is going to join us in just a few moments. First today, Ballad health officials say they are encouraged by recent numbers they're seeing in local COVID-19 cases, but they say we are still far from seeing the end of the pandemic. Today, Ballad reported a drop in COVID-19 patients in their hospitals for the 6th straight day. They currently have 245 COVID-19 patients, their lowest number since December 4th, and 90 fewer than 1 week ago today. 58 of those patients are in intensive care units, 33 are on ventilators. Ballad also reports a 25.2% positivity rate among those being tested for the virus. It's down 7% from a week ago. And joining us now to sort all this out once again tonight, Ballad's Chief Infection Prevention Officer, Jamie Swift. Jamie, thank you so much for being here. You know, positivity rate is down. Some numbers are looking good. Is there a reason to be optimistic right now?
There is, with caution. So, you know, obviously, anytime we have a decrease in numbers like we've seen over the past 7 days, that's reason to celebrate and be thankful that our hospitals are feeling a little bit of relief. But, you know, that's still a lot of patients in the hospital with COVID. The positivity rate certainly coming down, going in the right direction, but still a lot higher than it needs to be. It needs to be under that 5%. So, you know, people need to hear the news, but they need to hear that news and really make sure they double down and keep doing their preventive measures so we don't just turn around and go right back up.
Now, we have talked about a little bit about this variant strain that we've been hearing of, and you had mentioned that this could be the new dominant strain within a couple of months. Are we concerned about that yet?
Yeah, so, you know, that was taken directly from CDC. That's what they're feeling, that in the U.S. that'll be the dominant strain probably by March. It is obviously very concerning. You know, it's not necessarily more severe, but it is more infectious. And so what we know is if there's more infections, then more people will end up in the hospital, and then you will have more deaths. So, you know, certainly we're concerned about that. We're keeping an eye on it. And right now, the focus has to be on the race to vaccine to get ahead of that variant.
Have there been any cases that you know of this variant strain in our area yet?
No, not that we're aware of.
That is very good news. Okay, what about, are we in good shape to have enough vaccines here? Is the supply, is it meeting the demand yet? Or do you anticipate that it will eventually meet the demand?
You know, the answer is eventually. It's going to take a while. Obviously, you know, the demand is much higher than the supply right now. We're working with departments of health in both states to make sure that we're getting vaccine to the people that need it the absolute quickest in conjunction with our health departments. But, you know, we all need more vaccine. We all have people on, you know, waiting lists and who want appointments and are trying to call. So by all means, the demand is far outweighing the supply. But we do know that there will be enough supply. It's just going to take a little while to get that to everybody who wants a vaccine.
Something that we talk about, maybe some people don't hear it very often when we're running all these numbers and different things. We've had thousands of people actually recover from this virus in our region, which is wonderful. Is there a period of time for these people that they should wait before getting a vaccine?
You know, the short answer to that from CDC is, you know, once you had COVID-19, yes, you still should get the vaccine. You really need to wait until you're out of your isolation period. So make sure you're out of your isolation period and recovered. You don't want to have any symptoms. Some people say you can wait up to about 90 days to get that vaccine if you'd like, if you want to give it a little bit of time. The only real guidance for sure is if you received monoclonal antibodies or you receive convalescent plasma as a treatment, you will need to wait at least 90 days before you can get vaccine.
Well, let's talk about that convalescent plasma really quickly. We've heard from the Red Cross that there is a shortage right now of convalescent plasma. Are you seeing a shortage? Do you feel there's an urgent need for it right now?
You know, we always have a need for convalescent plasma, so it's why we continue to talk about it week after week. We really do need people that have recovered to go make that donation.
And I know this sounds silly, but people who are like, well, wait, our numbers are going down, everything's going really well. How important is it to make sure that we stay on this path as we see a vaccine that's finally out and hopefully head towards the end of this?
It's really more important probably now than ever. So we've just come off our third peak. You know, we know what will happen if we let up. So we'll just go right back up. So we know with a 25% positivity rate, the burden of the virus is still high. We know there's potential of the variant strain arriving, you know, in surrounding areas at any point in time. And so it's really important that we continue with masking, social distancing, good hand hygiene, get the vaccine as soon as you're eligible, continue all of those things until we really start to see the burden of virus decrease in our community.
The fight continues. Jamie Swift, Ballad Health's Chief Infection Prevention Officer, thank you so much for joining us. A lot of good information today.
Thank you.